don't think a continuous investment in that location makes sense on a bigger scale. Lori?
Yeah. Exactly my concern.
Mhm.
Is how much more money are we putting in this location?
Great.
And can you?
Sure, I don't want to misspeak, so I will validate and come back to you maybe next meeting.
I mean,
It's more than a year, I just don't remember if it's 2 years or what. I will validate the time frame associated with it, because I don't want to misspeak.
curious to see.
Agreed, that needs to be part of our, Helen and I have been having those conversations. It's, I'm sure, just like we told you before, it's extremely challenging finding a location, so we're trying to look at options, including, do we have to maybe split that up, right? Like maybe not have one location and maybe have 2 locations, and we really are open to things, but having something being in a geographic area that makes sense on a bus line at a reasonable price that you don't have to do a ton of construction to, right? Those are, as we all know, to your experience, right? It's a challenge. So we will continue to work on it. So again, we still want to, that space though, to be conducive for the people that we serve and the staff. So we're trying to balance that. I'll give you another example, even though it's not here, you've already previously approved it, but we're purchasing some additional things like stand-up desk. We're having our own staff, as in a facility staff, paint some offices to make it a little bit more friendly, welcoming, that type of thing. So we are spending a little bit of effort because again, we have to be there for the predominant period of time in that building, and the facilities and the desk and chairs and things still need to be upgraded. And as you know, investing in the desk and the chairs, no matter where we're at, we get to take them with us. So that's kind of our effort. And then also some rather inexpensive, like sound reduction things that are both decorative and inexpensive. And those are also items that we can take with us if we have ultimately found a space. But it is a true challenge. I just want to make sure you guys hear that finding a space, yeah, it's not a easy find.
Okay, thanks, Tracy. Any other questions for Tracy? Nick?
To that, one of the big challenges and all that was transportation, and you had formed sort of a task force or a group to try to look into the transportation needs, which is a problem for everybody, but a particular problem for the people we serve. Is there any progress on that?
I appreciate you bringing that up. I have owed you an update for a while, but I was trying to wait where I could physically show you something. So luckily, earlier today, Thomas and I were just going back and forth. Thomas, along with a group of small individuals, have developed a transportation resource guide. That's the challenge right now is we're trying to make it a little bit more searchable, but just as a friendly reminder, the Medicaid health plans are required to allow transportation, right? But we know sometimes, right or wrong, those aren't always as available or reliable, or again, not for everybody, not available for everybody. Also, local cities have some free or reduced costs. So imagine this transportation guide. It's currently on our website. You just can't see it because it's not published. You would be able to search by the city. So let's say Sterling Heights, and then it gives you the contact information, the phone number, that type of thing to get to the available resources within Sterling Heights being an example, or it would have meridians, or it would have like all the various resources. So as far as an update, that's where we're at. As we first said, let's figure out what already exists, because as you guys know, we don't want to be the transportation solution. That's not our expertise, but trying to collect all those resources. And then, Nick, where we owe additional strategic planning is now that we know the resources and we've made a guide for people to access it, we need to publish it. But then in addition to that, we need to figure out now where does that position us? Because even though there's resources, there still is a gap in our community.
Does that include, I assume we're also looking in Warren as well as Sterling?
Oh, yes, the entire Macomb County area, just to be clear.
And have there been any further discussions with SMART?
No, we've drawn their attention to it. I welcome everybody's thoughts, but in my status, we wanted to find out what's available now, what can you do, educate the community. And then I think when we had previous conversations with SMART, they're very open and willing to assist, but we need to have a much more specific ask. And I don't think we had the knowledge base to have that very specific ask.
Gotcha.
And I still don't think we're quite there on that.
Okay, thank you.
But I will show you guys once we publicize it, one of the future meetings, we'll share it in a board report so you can access it, but we will probably publicize it, but maybe use it for a little while, as not draw everybody's attention to it. So that way some people can try to test it out and see how helpful it is or what challenges they might arise. And I just want to thank Thomas, and you guys aren't familiar, but Kim Embers and Tiffany Chun, who spent a decent amount of time hunting down these resources and trying to make it as user-friendly as possible.
Okay, Selena?
I mean, we have to take a look at the lease, but I think when we were looking at the lease originally was this whole big giant building being moved into another big giant building. So perhaps what we have to do is take a look at the offer, and we may have to split them up and put them into two separate buildings, which you may find a little bit easier. Because even if we only can move the entities first, and then some of our associates may get displaced for a little bit while we find that additional building. But I really appreciate that idea that maybe we don't look at this big whole package, and we might have better luck breaking it apart.
I was just gonna say, as far as smart, I mean, Tracy was right on when talking about exactly what we need. That is one of the main questions that they're asking, like, what is it that you need? Because when Phil and I spoke with them, first of all, Smart is trying to get money to run Smart. So of course, the promises were made that absolutely could not be met when we actually said, "Hey, remember us?" And they're like, "Oh yeah." So the person that was over Smart before is no longer there, and we are working with someone that is very open and honest. And I think once we're able to really specify what we need, she is going to help more to get us what we are looking for. But she did confirm that the timeline, because Phil and I brought up the question, what about if we find the building, can we have a bus stop added? And that timeline is very long. So we can find the perfect building, ask for a bus stop to be added, and we will be providing transportation for 2 years. And that's not, I don't know. We are, like Tracy said, we are not, that's not our field of expertise. And then, but, to say, Smart is willing to work with us, wanting to know exactly what we need so we can, maybe use their smaller forms of transportation, because they are expanding that more in the next year. So that may be an option. But once we know more, they are willing to come to the table because they will need their millage on the ballots. So that's good for us.
Okay, thanks, Antoinette. Lori? Donna?
I know when we moved, I don't know if this,
You had it on.
okay.
Now it's-
I know when we originally moved to West, I guess I'm thinking about the answers that I would like to hear from whoever was around when we moved to West. I don't know if we had a bus stop then.
We did not.
At that facility. So how did we get a bus stop? And how long did it take to
similar
get a
stop-
bus stop?
I don't want to misspeak, so anybody who remembers who's here, I want to say it was a year or a year and a half. It's
So somehow we got a bus stop.
Yeah, they're
able
to add to
so-
It just takes.
Yeah, so, I guess there is a process to get a bus stop, like within a year, So, wherever we do, and for those of you that are new on the board, the big reason why we didn't move was because we had members come forward that were concerned about the fact that there wasn't a bus stop, and they came here and spoke to the board and were concerned about, not being able to get to the facility because the West has a bus stop that's close. So, that's why we're talking about bus stops and transportation, is because we have people that are on walkers and have a difficult time walking, and, it's a concern for some of our consumers. So, maybe that's something that, if we knew where we could move, we could start the process right away.
We could, I just, and that's, we just have to make that part of the plan, the way that they're most likely, if they don't already have one, there most likely will be a period of time, even if we're proactive. The challenge, remember, this is just like real estate, right? Even if you were to buy your own house, if you give an analogy, you often have to move much quicker than we, so I just want to acknowledge that most likely, if we're able to find something or some things, we have to be able to move quicker, right? And sometimes we're going to have to make best laid plans and best laid intentions with efforts to do that and know that. I just am acknowledging, yeah, like landlords, like the last one we were on, the landlord, we literally had for months had to I know we didn't move forward, but it was not a simple process to allow them to keep engaged with us because they have other choices, right? I mean, I'm just kind of acknowledging. So if we can move forward, try to be as nimble as possible while still making a very strong strategic decision for the community.
Well, they went with about a year without a bus stop.
Over a year. I don't know the exact time frame. I can verify, but I know it was at least more than a year. I know that part, but I just don't know how much more than a year. Yeah.
Megan?
Yeah, not directly to Donna's question, but related to it. I quite frankly, we were looking for them to make a loop to their current bus route to accommodate the move we were talking about. And quite frankly, I was very disappointed in the smart leadership not being willing to consider that when several years back, I represented a territory that included the Macomb Mall, and I met with the director of SMART and complained that they stopped running the buses there at 5 o'clock at night, even though it was a hub, and that the people who came to work couldn't go home because they worked till 11 o'clock or 10 o'clock. And within 2 weeks, he had extended those bus routes from 5 to 11. So it can be done more quickly. And I'm glad you now have somebody there that's more user-friendly, shall we say, to the bus riders, because that made a that one change made a big difference on how many people were on the bus on Gratiot. Yeah, you don't take the bus to work if you can't take the bus home, and it made a huge difference. And it was just like common sense, and once it was pointed out to the then director, the change came very rapidly. So they can make a loop change in the route a lot easier than they're telling us.
Okay, thanks, Nick. Megan?
Just kind of echoing Tracy on the speed in which we'll need to move with that. There's a lot of things that would make us, I mean, we're fabulous, right? We all know it. And no, obviously the people we serve are the most fabulous, but there's a lot of things that make us unattractive to a landlord. You know, my fellow real estate negotiators will feel that. Just out of curiosity, how many square feet are we looking for? Off the top of your head, what's west? Do we know?
The west is 50,
50?
60,000. It's going the time, but that particular space has some storage, which we would still need some storage, and it has the atrium, which is like wasted space, as in it's a bad layout because it was an industrial building that got changed into that. So we wouldn't actually need that. And of course, to the earlier point, we could like maybe it's two places, right? Like this for that. If my memory goes right, the place that we were proposing last time was I think 20,000, 25,000. But remember, we actually were taking part of the west and putting it at the current administration location. So it was a kind of a division, because I do agree finding a space with, even if it's 40,000 square feet, that's going to be, just not doable. So currently we think we could pare down, to answer your question more specifically. I believe it was 25,000. Does that sound right, Helen? I don't want to misspeak if you have a differing recollection, because we tried to do it, like if we got rid of this, this, and this, while still having the space needed. And don't forget, we did the West location way pre-COVID, right? So we have a different kind of solution and model, so it does change kind of what our needs are.
Right. Yeah, and we'll just have to, again, too, it's not just seeing like a big shiny new building, right? It has to be zoned specifically for that. We need to push for so much tenant allowance for them to build it out for us and get that money back. I know that's the hard part, but we got your back. We'll be snappy. Thank you.
No. Anything else?
Can I just add one more comment related to the transportation? It will have, Nick, in the transportation resource guide, all the smart, or maybe it was internet resources in there too. So it's another, imagine the concept would be, I go here and here's all the known things that we exist. And you might have to, person looking for a solution, you might have to use a couple of different resources on a couple of different days, because unfortunately a lot of the resources that we have identified are either not reliable or consistent. So
Right.
it's almost like your babysitter. You can't just have a babysitter. You got to have like 3 and 4 deep. right? Similar concept in the transportation area.
Okay, thanks, Tracy. Anything else? All right, we have a motion and support. All in favor? Aye. Any opposed? Motion carries. Item 5G, request to approve out-of-state travel costs for 2 members of Crossroads Clubhouse. I'll take a motion. Motion by Donna, support by Jackie. Diana?
Hi, good evening. So we had previously approved for Samantha Zalupski and the new Crossroads director, Jennifer Zimmerman, to travel. The original location was closed for training, so they've had to switch locations to Salt Lake City, Utah. And with this request, it's the transportation costs that changed, and we added for Jennifer. And these are all required trainings for Clubhouse International.
Okay, thank you. Any questions for Diana? All right, all in favor? Aye. Any opposed? Thank you.
Thank you.
All right, item 6, receive and file. 6A, MCCMH Compliance Annual Report. I'll take a motion to receive and file.
So moved.
Motion by Antoinette, support by Lori. Chandra?
Good evening.
Good evening.
May it please the board, please allow me to formally introduce myself. My name is Chandra Cozart, and I'm going to provide a brief overview of the Privacy and Compliance Annual Report. So please follow along with the slide deck that was included with your packet. So this interview introduces the compliance department. It will also cover functions and key compliance laws, the annual effectiveness evaluation, and also fiscal year 25 data and reporting channels. It seems like a lot, but I promise I'm going to condense it. Okay, so just a bit about me. I am the Chief Compliance and Privacy Officer for Macomb CMH. I am a licensed attorney. This is going on my 21st year of being licensed, and I also have many, many years of cross-functional experience in compliance. Some of the functions of the compliance department includes pre- and post-payment investigations, overseeing the compliance program, liaising with MDHHS, OIG, and MFOCU, overseeing data privacy practices, monitoring, auditing, and a host of other functions. So before we discuss a summary of laws impacting compliance, I think it's important to note that what compliance program actually is. So a compliance program is an integrity framework designed to ensure adherence to legal and regulatory requirements. Macomb's program includes governance, oversight, written policies, disciplinary standards, training, reporting channels, and corrective action mechanisms. And for our new board members, the board established the compliance program around 2001, and MCCMH has maintained a strong program focused on detecting, preventing, and recovering payments related to fraud, waste, and abuse, and Medicaid. So some of the laws impacting compliance would be the Federal False Claims Act, and the purpose of that law is to impose civil liability for fraud involving any federally funded contract or program. There is also, let me just backtrack, specific intent is not required. There's also a Michigan component that's called the Medicaid False Claims Act. Under that, it's a felony to make, present, or cause to be made or presented a Medicaid claim that is knowingly false. Honest mistakes do not qualify. Each law has whistleblower protections to protect people who want to come forward and report fraud or abuse. These are called qui tam lawsuits, and part of those whistleblower protection prohibits retaliation. Okay, so now I'm going to talk about the compliance program effectiveness overview from the annual report. As you can see, the SIU, which is the Special Integrity Program Unit, was a 9% year-to-year variance from fiscal year 2024. So the action taken in that area is that we implemented workflow efficiencies to cover that variance. Also with training and education, which is a key component. There was a slight decline, however, provider education had exceptional growth that was approximately 620% of the previous fiscal year. We have 3 key performance indicators that I just want to talk about today because those performance indicators are really key to let us know that our compliance program is moving from reactive to preventive. So as you can see, the case intake concentration increased. It was 74.15%, and that's largely due to awareness efforts and education that was pushed for fiscal year 2025. The case closure concentration also increased, and in addition to that, the distribution of concerns increased, which means that we are detecting issues early and not after the fact. Okay, so our trends for fiscal year 2025, similar to 2024, continue to be audit findings. That was the major driver. The next one would be billing and documentation issues. And we have put in place mechanisms and training to address that trend. I will also note that collaboration-related matters emerge as a new growth effort, which we expect that because, again, our mission was to be known as the KNOW department, no department instead of the NO department, to, again, have people come to us before an issue arises so that we can mitigate it up front. Okay, and the program integrity incidents, the highest amount was 72% in concerns, and again, that reflects that goal that we have of being preventive. So that essentially means that for every reportable case, approximately 4 of those cases were concerns. And for HIPAA, it says 7% were reportable, but that 7% is just one case. Okay, so substantiation rates, 35% of those reported were substantiated as either fraud, waste, or abuse. And the breakdown of the fraud, waste, and abuse, waste was the primary driver at 75%. Overpayments and encounter corrections. Overpayments identified were higher in 2024. However, the encounters adjusted were higher in 2025. With that being said, the adjustments were less than 0.08% of premium revenue. Okay, and just a bit about using satisfaction surveys to measure effectiveness. Compliance functions rated 73.4% as very satisfied or satisfied, with 24.6% providing neutral responses. So those results highlight strong provider confidence and opportunities for continued improvement to, again, push awareness of reporting channels. And if you have any questions, please feel free to let me know. I have included reporting channels for both CMH and MDHHS in the slide deck.
Okay, thanks, Chandra.
Thank you.
Any questions? Nick, you have a question?
I have 2.
Yes.
I noticed a rather dramatic shift in training education from beneficiaries to providers. What's driving that? Do you know?
What's driving that, if you review the annual reward report, would be the risk areas. So the highest risk areas in terms of fraud, waste, and abuse would be claims and billing. So a targeted effort was made for provider education.
Okay, and you indicated that waste, fraud, and abuse has become such a catchphrase now, I don't know that anybody really knows. I know what fraud is, that's pretty easy. I know what overpayments, underpayments are, and how those get cost reconciled. How are we defining waste?
Sure.
Because that's the largest component.
That is the largest component. So we are defining waste as overusing resources which are unnecessary, such as ordering excessive tests, using high amounts of units when it's not necessary for the person. So that's how we're defining waste.
Gotcha. Okay, thank you.
Okay, anything else, Nick?
Nope, thanks.
Julia, did you have a question? Okay, any other questions? Okay, thanks, Chandra.
Thank you.
Dana, can I just add some additional context? One, just to express the deepest appreciation to Chandra and her team. They really do a fantastic job. If you aren't picking up on this, I understand that this information can be kind of a lot. Even that's why we tried to give you like a summary of it, even though you have the full report. The one pager she did, if that's helpful, is probably trying to give you the best kind of summary of a very complex thing. I would also want to draw your attention to kind of feeding off of what Nick is suggesting. We have 2 full-time staff that this is their sole thing to do because it's what we're required to do. And the state of Michigan continues to expand and expand and expand and expand to ask for data, reports, checks and balances. That's not a complaint. But I just want to kind of acknowledge that our system of care, and not just those 2 staff, because remember, every time Shonda and her team has to do something, the reality is the whole system has to do something. She's just the conduit to make it all happen. So we're just kind of acknowledging checks and balances are amazing and we agree with them, but there is this administrative task and increase that continues to grow, and they continuously change their ask and what they need and how they need it. And sometimes that is, their directions don't always keep up with the requirements.
Go ahead, Donna.
When you were talking about the waste, and you said like there's an excessive amount of testing or, and I forget what the other normatives that you used, is there like a standardized, what's the standard that you use to know how much testing? Is it like a CMH standard, or is it a across-the-board standardized amount that, where do you get the norm from?
So that is person-centered. Once an issue is identified, we ask for a clinical review in MCCMH to determine if this is normal given the person's IPOS and clinical background, or if this is not normal. Yes.
If it's helpful, it's managed care specifically, so that would be the separate division. It wouldn't actually be the clinician who asked for it, right? It would be like the managed care part or division that would do that. And if it's just as a friendly reminder, in addition to our managed care team, if a service is denied for any reason or reduced, we actually also have a third party, PhD or, DO or MD, also review it to ensure that it's kind of in compliance with and it meets medical necessity. But I agree with Chandra, it's very person-centered based. So if someone says, is there a standard, there's some rules of engagement, but after that, it's very much based on the very specific clinical needs of that individual.
Any other questions? Okay, I was just gonna say this one page actually was very helpful, so thank you very much. Okay, thank you. All right, item seven, other possible agenda items. Reminder that we have a CMH Board Recipient Rights Advisory Committee meeting on Thursday, April 16th at 8 a.m. That is at the Administration Building. And then reminder that we have a full board meeting on Wednesday, April 22nd at 6:00 p.m. here. Item 8, provider comments. Any providers wishing to address the board? Okay, item 9, hearing of the public. Anyone from the public wishing to address the board? All right, any board members with any comment? There we, okay. Motion by Nick, support by Sharita, all in favor? Aye. All right, we're adjourned. Thank you, everybody.